Welcome to another Pod Toyos Talks. We got an exciting one today. Amanda Cardwell Carones. She's a global healthcare strategist and founder of Ophthalpreneurs, the first international community for business innovation in private ophthalmology. Trained as an epidemiologist, she bridges the clinical and industry worlds to drive adoption, advance technologies, and help practices grow with purpose. She's based in Milan. Amanda partners with leading clinics, medtech companies worldwide to fuel smart, sustainable growth. She's been in everything in ophthalmology. She's been in industry. She's seen a practice firsthand. She's married to a very famous ophthalmologist, Dr. Carones. The first question I want to ask you is you've seen the US healthcare system and you've seen the Italian healthcare system. People always want to know what's different about what we're doing as opposed to what you see out there.
Oh gosh. Okay, well, the first thing I have to say is neither system has it right.
Yeah, that's
That is 100%, my belief. Um, it's vastly different coming from the US having, had private health insurance versus coming to Europe where most things are covered under the national healthcare system. Um, I personally, if I had to choose one or the other, I personally would go back to the US system, um, which, surprises a lot of people because, you know, I think when you're on either end, you only hear the extremes. So if you're in Italy and you're talking about the US system, you're hearing how there are people who are, underinsured or uninsured. If you're in the US, you're hearing how everybody has access to free care. And to be honest, I think that the change has gotten more extreme, or the difference has gotten more extreme post COVID over here in Europe, at least in Italy. And it's different in different markets because even though most have some sort of NHS system, the reimbursement structure may vary greatly between, say, Germany and Italy. But in Italy, it's extremely difficult to access care under the public healthcare system these days. You have to jump through hoops going to a primary healthcare physician first, who sends you the referral to go to a specialist. I recently required an MRI of my shoulder and of my neck. And if I had gone through the NHS, the first available appointment was over 6 months away.
yeah,
Going privately, I was able to get an appointment the next day.
yeah.
So, I think that's one of the biggest changes when it comes to things like laser vision correction, which is purely elective in both markets. I don't see a great difference when it comes to IOL surgery, for example, for cataract. Uh, there's probably not so much difference either between the US and Europe in that if, in many markets in Europe, if you have a cataract, their copayment is allowed, just like it is with Medicare, with private insurance in the US. And then there are other markets like Italy, where in most of the regions, copayment's not allowed. If you elect to have a premium IOL, it's 100% out of pocket.
Yeah, sometimes, yeah, it's funny because everybody thinks there's an easy answer and there's really no easy answer or perfect system. Uh, on Twitter this morning, I saw a patient was just talking about getting into the healthcare system for the first time. They went to the ER, they had to be admitted, they get some bill of $40,000, and they were like, what is this? And is there sticker shock like that in Italy, or you don't have that part?
No, not at all. So even if you were to go purely out of pocket, into the private healthcare, practices. So like for us, even though we have access to the NHS, the only time I'm taking advantage of the NHS is if I truly have a life-threatening emergency. And at
Mhm.
that point, I will go to one of the public hospitals. If it's anything that I have flexibility and time with when I schedule my appointment. It's not something that's life-threatening. We always go privately. I can, get an appointment much quicker. I can get an appointment with the physician that I want to see if I go privately. And prices are much more reasonable and in some cases the government controls the pricing. So, for example, with pharmaceutical products, there's the price that you may or may not have to pay as a portion under the NHS, and then there's the price that's fixed that you would pay pure privately. And it's vastly different than what you pay in the United States for the same product. So yeah, you don't have the issue with sticker shock. You just might have a less comfortable situation if you're going through the NHS versus going privately.
So for that MRI, what did that cost you?
The MRI,
Yeah,
200 euros.
200 euros. See,
Hmm.
I think, yeah,
And I got an appointment the next day. But I'll give you another example.
okay.
Um, in 2019, in November of 2019, my oldest son, who was, gosh, how many years ago was that now? That was 6 years ago. So I guess he was about 6 years old, 5 or 6. Um, he most likely he had COVID before anyone knew what COVID was. So I had taken him to our private pediatrician. This was on a Thursday, who said, he definitely has some sort of pneumonia. She had put him on a couple of different medications and a nebulizer treatment. And she said, if he is not better by tomorrow, take him to the emergency room, because she said, if I prescribe a chest x-ray or blood work, you're not going to have the results back before Monday. And she said, I don't think he needs to wait the entire weekend. So if
Mhm.
he is not drastically better by tomorrow, due to the antibiotics and the nebulizer, then take him to the emergency room. And that's exactly what we did. So they kept commenting about how it was the strangest pneumonia they had ever seen. It looked like broken glass. His blood work was completely normal. So the only indication were, that he had just started coughing, and then of course he had the chest X-ray. So that's the situation over here where, if you because the majority of care is provided in the NHS, you have to go through the NHS system in order to get faster results. And in this case, it was the emergency room.
Yeah.
If he had gone through any other way, it would have taken days, if not a week, to get an appointment. So,
And at least the doctor was upfront with you and said, "Hey, you should go this route."
yeah.
So is that typical? Would that be something that you hear often, that a doctor goes, "Hey, we could go this route, but this is going to be 6 months or weeks or whatever. You may want to go to the private route."
Um, the ones in the NHS actually don't typically talk to you about the private route.
Okay.
The private doctors will talk to you about, if you go through the NHS, it's probably going to take you this long to get a prescription or to get your test done. If you go through the private system, here's how long it may take you to get an appointment. So again, it's such a small percentage of the population that uses, pure private health care. Private insurance is growing in Italy, but it's still a very small percentage. So most people are still seeking out the public healthcare system. And the thing is it's probably second to the UK in terms of how protective the Italians are of their NHS. They've paid, into it their entire lives. In my case, in Italy, I pay nearly 50% of my income in taxes. So the
Hmm.
tax rate is extremely high. It's one of the highest in Europe. And, they feel like they're assumed that they're getting the best that there is to be offered inside the NHS.
Hmm.
And I've had conversations. I had foot surgery some years ago and in the private system. And when you go to the private hospital, you take your number, your ticket, you wait, 20 minutes, 30 minutes to do registration, you pay, and then you go and you may wait another 2 hours to be seen by the surgeon. So it's not the service level is not drastically different from what you would see in the public system. And I remember there was a little old lady there who had had surgery recently with the same surgeon, and we were both checking in for post-op visits. And I turned to her and I said, this is absolutely ridiculous. I have paid 5,000 euros out of pocket above and beyond what my insurance, my private insurance that I have paid for, has paid for this procedure. I don't understand why I'm going through the exact same experience that I would have if I was going into the public system. I expect more value for my money. And she looked at me with a puzzled look on her face initially, and then you could see she had an aha moment. And she goes, I have never thought about it that way. She
Yeah.
said, I guess I've always assumed that that what I would typically see in the public system is as good as it can get. And when we think of going privately, it's to choose the date and to choose the doctor. And
Mhm.
beyond that, we've never had higher expectations of what's delivered in private and than what's delivered in public. And I said, I'm coming from the US, I expect more value for the money that I'm paying.
Yeah.
And I don't feel that I should sit here and wait 2 hours to be seen for a post-op visit with my surgeon because he showed up late. I
Mhm.
feel like if I'm paying and choosing to pay him out of pocket, I should be seen in a much more timely manner. And I think now, for good and bad, there have been a lot of changes since COVID. And I think now, out of necessity, so many people are having to seek private care instead of public because they're not willing to wait. And now that they are going privately, they're starting to have higher expectations of what's being delivered. So I think that that's a positive change we'll see in healthcare in general, over here in Europe as now, the expectations are much greater.
Well, those are some of your takes on LinkedIn. I follow you very closely and what you're saying, and you're trying to raise the level of what doctors are doing in their office, especially in the fee for service market. And yeah, and it's great because you're coming from different angles because you're coming from a consumer as well as somebody who works with practices and somebody who's been in the industry, and you're saying, hey guys, you got to step up your game. So tell me some of those things, just like what you just said. We really have to, what do we have to do, what are we doing wrong in our clinics?
For private practitioners, for private ophthalmologists, COVID is probably one of the best things that could have happened in terms of helping to drive growth. Because not only did we, and you see this in the news a lot lately for some negative things associated with cataract procedures in the UK, but the wait list became very long. Patients who were scheduled to have cataract surgery in Italy at the time COVID hit, they didn't just the wait list didn't just remain the same and it got postponed. The people whose dates came and went for surgery got put back at the end of the line.
Mm,
And today, depending on where you are in Italy, if you're having a cataract procedure performed in the public system, it could be up to a year long wait in order to have the first eye done.
yeah.
So, not only did has that become frustrating, but on top of that, you have the baby boomers who are now starting to be diagnosed with early cataracts, and some of them are, you know, are well into into cataract. Um, they have grown up with more of an immediate gratification type mentality, and
Mm,
they're not willing to wait and let that cataract continue to develop, their vision continue to deteriorate for a year. So they're starting to explore, alternative options, not even knowing that there are other lens options available. They're just looking for how soon can I get this done outside of the public system because I don't want to wait. And then, of course, when they get into the private practices, they now start to become aware of other options that are available. And that's where I think that we still have a huge opportunity within private ophthalmology is we have not done a great job in educating the general population on ocular health, period. We have not done a great job of educating them on vision correction procedures in general. There are, we as in refractive surgery, we've done ourselves a disservice by calling it refractive surgery because, and I ask this sometimes when I'm at different congresses, I'll ask the audience, how many of you have partners who have nothing at all to do with ophthalmology? And most people will raise their hand. And I say, how many of them would be able to define refraction. And
Hmm.
almost none of them raise their hands. And I'm like, if they can't define refraction, why would they even understand what is refractive surgery? So we've
Yeah.
called it something that the general population can't understand. And then on top of that, throwing out all of these different technical terms between different procedures and different, brand names for the same procedure has only driven confusion. So I think that, we now have people for out of necessity looking for options in private, we have to step up our game in terms of providing education that's out there for them to find to help bring them into the practice and making sure that it's good, solid information that they're reading and not just kind of the junk that floats around on the internet.
So a different term than refractive. What would you call like a premium lens, LASIK? Where would you define all of that for the patient?
I think we're making it a lot more difficult than it needs to be. It's vision correction or vision improvement
Mm.
specialist.
Yeah.
And regardless of whether the patient has a cataract or doesn't have a cataract, our goal is to help to correct their vision or improve their vision. So the more simple we can keep it, because, quite frankly, a 60-year-old patient frustrated with glasses may or may not have a cataract, but they're looking to improve their vision. So if
Mm.
we start talking about cataract and this patient is not, they know that they're past the age of the typical LASIK patient, they may think that there's no solution for them.
They
But if
do.
we start talking about vision correction or vision improvement, and we focus our communications on various different age groups, it starts to educate them that, hey, just because they're 55, 60 years old doesn't mean that there's not a solution to improve their vision.
Yeah. No, and I think you're right. I think we just make things uh, much more difficult than it has to be. And I have that moment when I'm explaining something to a patient and they look confused, and then I just have to start over and just go, look, I got to make this simpler so we can all understand what we're trying to get. And that you're right, that baby boomer generation that's playing pickleball, they want to improve their vision so they can hit the ball better and do all that stuff. You talk a lot about that in LinkedIn. Instead of talking about what we're going to do, talk about what we're going to give the patient. And so tell me a little bit about that.
So, I mean, I get it. Any surgeon, I had always intended to go to medical school, and I married my college sweetheart who is in medical school. And for that reason, we decided two doctors in the family were too many. I wish I had had people to look up to like you and your wife, and I would have said, no, they're not. We can make this work. Instead, I didn't go. But I do because I was married to him all throughout his medical school and residency. We eventually divorced. This was 20 something years ago. I did see how and know very well everything that you have to put into building your career as a physician. So I get it that you're very proud of all of the things that you've learned, all of the techniques and the skills that you've acquired over the years. So it's easy to want to talk about what you as a surgeon offer to your patients. The challenge is that first of all, if we look at refractive surgery or vision correction surgery, unfortunately, that's been commoditized. And we know that it's not true, but patients don't know that it's not true. They assume that anyone can do that job. So, the best way to capture their attention is to be the one that's talking about what's important to them
Mhm.
because you could say that you're the best, but they don't have any way of comparing you to someone else. It's not like they're going to one person for one eye and to you for the second eye. They have no way to compare. And and I know you've brought this up on a previous podcast as well, and I use the analogy to airlines all the time. When you get on a plane, we don't typically look at the pilot and question whether or not that pilot has the skills to fly the plane. We don't look at the plane and question whether or not it's in good enough shape to get us to point B. We assume that they have been properly trained to do their jobs and to use that equipment in order to get us to our destination. So when we go to an airline's website, they're not trying to convince us of their safety record. They're not trying to convince us of all of the training and the skills that the pilots have acquired. Instead, they're talking to us about what we can expect during our journey, and even more so, what we can expect when we arrive at our destination. And I think that's more of where we have to go in our communications with patients, because ultimately, they're going to forget, you know, how bad their vision was. It always surprises me how quickly a patient forgets how bad their vision was after they've had some sort of vision enhancement, vision
Mhm.
improvement surgery. So what we want to do is get them to start thinking about what that life could be like, because at the end of the day, that's what they care about. They don't care that my surgeon did 10,000 versus 10,001 procedures. They
Yeah.
care that my surgeon is going to give me my best personal outcome.
Yeah, and we know, we live in that world because we do the aesthetics portion and the oculoplastics portion as well. And I don't know why I never made that connection of, bringing, because we don't talk about all that stuff on the aesthetic side. We basically talk to them about, okay, you're going to this wedding, we're going to make your skin better so that you look good for this wedding. Those are the things that they're talking to us about and we're talking to them. And really, we should get back into what do you like to do and how can we get you there? I find it's what I mean, marketing, how do we put that into a marketing plan? You get these great posters of somebody rock climbing or windsurfing or, let's say, playing tennis or pickleball or something like that. How does that translate to the patient that this is what we're going to give them? That's where I have difficulties. How do I communicate to patients what we're going to actually do for them?
So I've become a big advocate over the past year of so first of all, I love video, and I think that video captures attention a lot faster than a static image does.
Yeah.
But what if that video that you were sharing was not of the patient looking at someone else performing a task? What if it was the first person visual of performing that task?
Mhm.
So if it's rock climbing, being able to look up and see that next hold.
Yeah.
If it's, snorkeling, it's being able to see what's immediately in front of you. If it's photography, maybe it's them holding the camera and they're looking at, or they're showing someone, but you're seeing where they're pointing to what's on their screen, where they're pointing to someone else, the image. So
Mhm.
showing it from the first person point of view, so you really get them to thinking about what is on the other side of the procedure. And it's the same way, you mentioned the aesthetic side. Um, when someone goes, let's say for, breast augmentation, they're explaining the look that they're hoping to achieve to the surgeon.
Yeah.
So it starts out with saying, what is it that you're hoping that I can do for you?
Yeah.
Help me understand what is your vision like today? What would be good vision to you? What frustrations is your vision currently causing you today? What do you think you could do better if you had better vision? And
Mhm.
now that enables you as the surgeon or your staff to be able to talk to the patient in terms of what's important to them, instead of just picking random, you know, examples out of the air. You mentioned, you were probably in the minority in saying that you look at your patients and you can see that something you just said went over their heads.
Mhm.
I've been in so many consultations where the surgeon is so focused on saying what they need to say and getting to the next patient that they don't even realize the patient didn't understand what was being said to them. And the
Mhm.
patient is too intimidated or embarrassed to ask for clarification. So that patient, leaves the room not really understanding what options were available to them. And it's the patient who ultimately loses in that scenario. So, I think the more we can focus on customizing the conversation to the patient, it helps the surgeons and the staff to stop sounding like a broken record when they're in the room with the patient and to really focus on that one-on-one connection.
Yeah, actually, that's the one thing I learned from the Ophthalpreneurs meeting was to utilize video, and we're using QR codes now to link them to videos of what we're talking about so that they can understand better. So not only are they hearing it from me, but they hear it from me in a video. So they hear it a few times before, and I can tell when I walk in the room that now they have a little bit more information, and I'm not starting from the ground up, that
From
they're
the
already
beginning.
they're already there, and now we're just having a more in-depth conversation of exactly what lens they're looking for and things like that. So speaking of ophthalmopreneurs, so for years I would go to conference and I would just feel so unsatisfied in what I got out of a conference, and I always said we need more conversations like what we're having now, and the conversations that I saw at the conference. So what made you jump into that void of starting? So we had a conference for 10 years, and it just totally killed us after 10 years of. So ours was aesthetics and dry eye, and I know how much work these things take. But what made you step into the void of doing a conference like this?
Well, so my career in ophthalmology started on the refractive surgery side of the business, and I worked for Alcon initially, so I was not, on the AMO and the Visex side of things, but I remember hearing so many doctors talk about how much they learned from Visex University.
Mm,
So, I knew the value that those types of meetings could bring. Um, so then eventually when I moved over to the lens side of the business, of course we had reps in the field who were working with the surgeons, but anytime it's company sponsored, it always comes with this sense of bias. The doctors always have their guard up, right? Because it doesn't feel like this is about necessarily about the doctor, but it's about the company, and the company is going to help the doctor to help the company, is kind of the way that a lot of them might feel. So fast forward, back in 2022, 2023, Francesco, my husband, and I had submitted an instructional course at one of the big major ophthalmic conferences, focused only on the soft skills associated with presbyopia correcting IOLs. And because that is something that is never talked about from the podium at these major conferences, but it is as much a requirement for being able, to be successful with PCIOLs as the clinical side of things. So, we talk about how to select the lens, how to do the calculations, et cetera, but we're not ever talking about how do you get the patient actually to the OR for a PCIOL implant. And that instructional course, we had a rock star list of instructors. It was not accepted. So we said, you know what, if we ever want to cover this, and we do feel that it's necessary to cover this, we're going to have to do it outside of a major conference. Now, let me stop there and say, well, why did we even want to teach other doctors how to do this? Well, because the more patients who have these procedures done, the more awareness there is, and it makes everyone's job a lot easier. If
mm,
if everybody does better, it's a rising tide. We all perform better. So it's in our best interest to help teach other doctors, right? So it's not um, you know, totally selfless in saying we want other doctors to be able to do this and do it successfully. On the flip side, if they do it and they don't properly select patients or they don't properly set expectations, it hurts everybody.
mm,
So, this is why we wanted to do that course in the first place. Well, as we began speaking with other colleagues, they said, you know what? It would be great if we could add this topic or add that topic, or we could discuss this and that. So, what was intended to be a one time, maybe a half day course turned into 3 days that was still intended to only be kind of one time, or maybe we'll do it every couple of years. And it just exploded on social media afterwards. So it was never intended to be something that would continue. But once we saw there was so much interest and, that it filled a gap that people had, then we decided, okay, let's continue to do this. But you're right, the amount of work involved with it was way underestimated. I mean, it takes an entire year to make that conference
No, it's
happen.
gonna dominate your life. This is gonna be your thing, and you're gonna be thinking about it all the time, and how can we make it better? But, it's so necessary. We don't get any of this in medical school. We don't get any of this in residency. You're seeing a lot more doctors doing executive business programs. I did one, and I wish, gosh, wish I'd have done it 20 years ago, because I learned so much. I actually used to make fun of my roommate in college because he went into business school, and I go, you partied here for 4 years, and now you're going to party some more at this business school. And he was telling me, oh, how difficult and what he's learning. I'm like, I don't want to hear it. I was out, and I was studying till 2 in the morning, and you were out partying somewhere. But then you do it, and then you go, oh, you get all these aha moments, and the meeting, and you should feel proud about this. The meeting provided a gazillion aha moments, not just for me, just for other doctors as well. And we don't get this. And these messages that you're saying of, we've got to, how do we approach the patient? These conferences, we never talk about that. We always basically talk about what you're saying, picking the right lens, what laser to use, when, and all these other things. And we're kind of missing the big picture. So one of the groups that you brought in was the funeral home, and how they advertised their funeral home, TAFO, which was amazing. So what can we, just a little bit, what did you and how did you bring a funeral home to teach us about advertising?
Well, I figured that would get people's interest. Like, what the heck? To your point, what the heck? Why are you bringing a funeral home into this? So, I've been in Italy for 15 years. It is the only name of a funeral home that I even know in all of Italy. And until a couple of months ago, there was not even a Tafo funeral home in Milan. The way I knew about them was from social media.
Yeah,
During COVID, they somehow started popping up on my Facebook feed and then eventually on my Instagram feed. And they don't use video mostly. They use just kind of static images. And the sense of irony and sarcasm that's used, but in an appropriate way, in a non-offensive way, always grabs your attention. And, as I started thinking about the planning for the meeting in Taormina, I was like, you know what? Yeah, I I think that there's something to be learned here. You know, death is, you know, one of the top four greatest fears across cultures and across the world. So is going blind. And people don't tend to talk about death very openly, or especially, funeral planning very openly. And in the same way that we don't hear people talking openly very much about vision correction or ocular health in general. And the fact that a funeral home has been able to amass the following that they have on social media, and I can't think of a single ophthalmologist that has anywhere near, or a single practice that has anywhere near as many followers, um, tells me that we probably can learn something from the way that this particular funeral home is communicating with the general population.
yeah.
And if they can get people to talking about, my gosh, do you follow Tafo? You should watch and see what Tafo has to say on social media and Instagram. I want people saying the same thing about, hey, have you seen what Dr. Toyos is, posting on social media? Because if we can start educating and normalizing that conversation, imagine how many patients could ultimately benefit from, vision correction procedures. So, and at the same time, when we do go to, especially company sponsored meetings or some of the smaller meetings where they may have something on practice development, it tends to be us listening to our own, which
Mhm.
means our level of creativity is pretty much stuck in a box this size.
Yeah.
When we start looking at other industries that have nothing to do with ours, rather than saying that doesn't work, asking the question, how could I learn something from this and make it work within our industry? That's when we have the opportunity to expand and to grow. So that's why I wanted to bring in, you know, someone like Tafo, Ricardo Pirone did an amazing job, and that was his very first presentation ever in
Mhm.
English, if you can believe that. And he had, everybody hanging on every word. That's why I wanted to bring in, you know, groups like that to be able to get us to thinking differently than how we've been thinking in the past.
Yeah, no, we're very, and this is why I tell people all the time, I don't read a lot of ophthalmology magazines and journals. I try to read other specialties, other stuff, because I want my brain to not get in this one track mind. And you're right, you get blinders on, and then you can't think creatively and you can't think outside the box. And I thought that was great. I think everything that you brought to that meeting was definitely outside of our norm and got people talking, got people thinking. And we do have to think in a different way if we're really going to be successful at this. It is kind of sad what's happened to the refractive market. I had LASIK 25 years ago. It's life changing. My patients say it's life changing when I do a procedure for them. How are we gonna change this? I mean, 10% is so low. 7% is low. These percentages, with all the technology we have and everything that we have, is just so low. I mean, I think to myself, if somebody would have told me in my 20s, yeah, I have this procedure I could do for you. It'll get you to jump 6 inches higher. What? 6 inches higher? Yeah, I'll take that, or this stronger or that. And how can we communicate that better to our patients? What should we be doing?
Well, I'm hoping that by bringing people together with organizations like Ophthalpreneurs, we can start to drive better alignment with the words and the phrases that we use.
Yeah.
Because again, if we take, I remember years ago, my first job out of grad school, not related to ophthalmology, I was working for Janssen Pharmaceutica, and there were only two of us. And interestingly, the other person is Kristen Brotherson, who it works for Alcon now. So
Mhm.
Kristen and I, we met before we were ever involved in ophthalmology. She and I were the only two who did not have, 5+ years in pharma in this particular district team that we were in. And when we joined, no one on the team wanted to help us. They said, no, you have to learn the ropes on your own because they considered everyone else on the team as their competitors. But
Mhm.
our team was ranked at the bottom of the barrel in the country. And we were at a district meeting, and she and I had kind of planned ahead to have this conversation with the rest of the team. And we said, guys, right now, we should focus as a team for being number one in the country. And once we are number one in the country as a team, now we can battle it out amongst ourselves who's number one and who's number 10. Because there's no shame in being number 10 in the district if that's number 10 in the entire country with over 300 and something people, that you're competing against.
Yeah.
So that kind of started changing the mindset of everyone on the team. And guess what? The next year, our team finished number one in the country.
Yeah.
So once we started, learning from each other and relying on each other's strengths to help us do better, we all rose. And I think if we can start bringing people together who have like-minded um, goals, where we are teaching one another, we're aligning on terminology, and to some degree, we're even self-policing amongst the group.
Yeah.
It will help everybody rise up. And let's face it, I mean, there should not be any competition between two practices because there are more patients out there who could benefit from vision correction than there are ophthalmologists who can treat them.
Yeah.
So there should be no issue with competing if we're all working in, rowing in the same direction and growing, the potential market. So I'm hoping that we can start doing things like that that will help us to do better. And in fact, even at other conferences, for example, at ACOS in London, there was an Ophthalpreneurs session there, and this is exactly one of the conversations that we had there is to say, how can we kind of align on, you know, let's stop creating confusion and align on how to better educate the population overall.
Yeah, and that's what I got from the meeting. It didn't seem like I was at a meeting with competitors. I was at a meeting with colleagues that were trying to do the same, get to the same goal. I want
Hmm.
you to do well because I know it's going to help me do well if we're not confusing people and not giving them these messages that are conflicting, because it does confuse the patient. These patients are confused. They come in and they go, "Oh, I didn't know the difference between this and that, and somebody said this and somebody said that." And I think there needs to be more of that in ophthalmology. That's why I think it's always be open, and until when I'm doing something, I tell, and it's working, I tell everybody about it. I always felt like it would come good karma. Like you're saying, it's not completely selfless. I feel like it's good karma and it'll come back to you. You just,
Yep.
you project that good karma, it'll come back to you, and your numbers will grow. And stop looking at us competitors. But you're right. If we're only penetrating 5% of a market because we're doing this headbutting and confusing everybody, and we can get to 50% of the market, that would be so much better for you and me.
Yep.
It,
I mean, and for industry as well, if we focus on, let's imagine that for industry, everybody has their percent of the pie, but the pie doubles or triples in size. None of their investors are going to complain about the share being the same share that it was when suddenly you've got that many more patients that are being treated with under that that percentage of the pie.
yeah.
And that's where I think, you know if we don't do this, so we've already said COVID gave us a gift by driving patients to look for options outside of the public healthcare sector, at least here in Europe. So those patients are going to become aware of different lens options. Now imagine that you have a surgeon who is opportunistic, who says, patient showed up in my chair and specifically asked for a trifocal IOL. I don't have experience implanting trifocals, but heck yeah, I'm going to take advantage of it because, I'm going to be able to charge that much more for it. So the risk here with that surgeon is a couple of things. First of all, they could put out bad product, meaning they put out bad outcomes, which ultimately is going to hurt my practice if I'm implanting a lot of those lenses because that we know that one patient is going to go tell everybody, whatever you do, do not have this lens implanted,
Yeah.
right? So that hurts me. Or what could hurt just as much is to have that same doctor doing super high priced standard monofocal IOL procedures. And so he's charging what I would charge for a trifocal for a standard monofocal, which is not good for the patient either. And the patient still doesn't understand what more they could have gotten for their money in terms of their vision. So I think, if we can stop that competitiveness just a bit and focus on actually where the benefits may come to the patient, to other practices, and ultimately our practice is going to benefit as well, then we could really do a lot more in terms of growth.
Yeah, and it's not only the doctor's fault. So I'm going to throw it to industry too, because
Yep.
industry, oh, our laser's better because of this, our lens is better because of this, and again, they're missing the point. that they're confusing the general population. So if they would just say, we have this product that can give you this, and the doctor will decide which one is best for you. Now
Yep.
I can get the industry talking to the doctor and saying, hey, this is why you should choose our lens, or this is why you should choose our laser. But let the doctor make the decision, because that's a higher level conversation. But your advertising should be different. Your advertising to the general population or direct to consumer should just be, we have these things to offer for vision improvement, and your vision improvement specialist will tell you which is the best option for you. So it's not just, it's, yeah, because I've had, one of the things with our conference is somebody would ask, well, are you going to be talking about this product? And I said, yeah, but we're also going to be talking about your product. Oh, well, we don't want that. If you're talking about this
Hmm.
product, we don't want you talking about that product. And I go, this doesn't make any sense, because you guys
Yep.
are in the same field. Patient A might be great for your product, but patient B won't be. So it's not just the doctors. I think this is something industry wide too, that should change as well.
I completely agree. And I think, some of the companies have begun to embrace that idea. They recognize, okay, if we continue to do things the way we've always done them, we're going to continue to get the same result. So maybe we should, try something different. And of course, they should be having, I mean, that's obviously that's their objective, that's their reps, responsibilities to be having those conversations behind closed doors with the
Mhm.
physicians. But when it comes to patient facing, I mean, you could have a patient who is conceivably a candidate for LASIK, for PRK, for SMILE, or lenticular extraction of any brand, um, or for ICL. And it is not worth arguing in front of the patient about why your option, why your offering is better than the other, because ultimately what happens is the patient says, you know what, better the devil I know than the devil I don't know. I
Mhm.
know what I can expect with glasses and contact lenses. I've got one doctor telling me ICL is better, another one telling me lenticular extraction is better, another one saying do LASIK, and another one saying no, 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 PRK is the safest. So, I don't want to make the mistake by choosing the wrong thing.
Yeah.
I don't want to choose the wrong doctor because, heck, maybe he's getting paid or she's getting paid by one of these companies. So I'll just stick with my glasses and contact lenses. Instead, having that conversation with the patient to say, there are options out there, regardless of your situation. There's likely an option out there that's right for you. And when you come in and we understand more about your specific scenario, we'll decide together which option is best. And then the doctor will have his decision tree and we'll take that decision for whichever option he thinks is the right way to go.
And I just had this conversation with a patient last week, because with Google and with the internet, they can do these research, and they're getting bombarded with all these lenses. And I tell them, yeah, there's a lot of great lenses out there, but you told me this is what you want, and I feel like this is the best option for you. And then that eases their mind. But really,
Yep.
it would be better not to have these conversations of, oh, this is better than that, and this and that, and this and that, and this and that. All right, we're
Well,
going
and
to end. Go ahead.
I was just going to say, and from your perspective, I mean, the last thing that you want, I would think, is for the patient to come in and tell you, this is the option I want, and it's an option that you don't feel comfortable with. It requires more work to undo this patient's mindset than it would have been just to have had them come in saying, hey, listen, I know that there are lots of different options available. You tell me which one is right.
That's exactly
And
what
I mean,
happened.
it would make things so much more simpler that way. So I completely agree with you.
So it took to finish that story. It took 20 minutes of my explanation, and then I brought in Melissa, and because she's had surgery, refractive lens exchange, it brought her in to re-explain it to her, just so that we could ease her mind. And it shouldn't have to be that way.
No.
I'm going to end with this. So we had just had a pod with a nutritionist friend of mine, and we were talking about food in Europe versus food in the US. And we were talking about food in Italy versus food. Anytime anybody invites me to Italy for a conference, I'm like, I am in, because I know I'm going to be eating well. So you've lived it. So what is your thoughts on the food in Europe, Italy versus what we're eating in the US?
Oh, hands down, it in terms of flavors, in terms of quality, Italy all the way. Um, I have never tasted tomatoes that taste the way they do in Italy. I've never had anything close to that in the United States because in Italy, the produce that's sold is whatever is the produce that is, currently in season. We can't go to the grocery store and get watermelon year round. We can
Mm,
get watermelon in the summer when watermelon is in season. Same with tomatoes. There are certain tomatoes that are grown only in certain months in Italy, but they are the most flavorful tomatoes ever. The only thing I will say is Italian food does eventually get old. I love it, but it eventually gets old, and you don't have as much variety in terms of other ethnic foods in
mhm.
when you're in Italy. So that's the only thing
Okay.
that I really
All
miss
right.
about dining in the States. I miss my really good Thai and sushi and Indian food from the States, but
Now, do you feel
I'll take the
healthier?
Italian.
But do you feel healthier on the Italian diet?
Absolutely, I do. Absolutely. I had a lot of allergies. Used to have recurring strep throat. I would have a strep throat even as an adult 2, 3 times per year. I had a lot of, some kind of in like digestive issues. Moved to Europe and I no longer have strep on a regular basis. I no longer have the issues with allergies and no longer have the digestive issues that I had before. And I'm absolutely convinced it has something to do with the diet over here.
Gotta be. And then your skin looks great, so it's gotta does helps your skin too, right?
Helps the skin. I get that a lot. That's also an advantage being from the States and as pale as I am. Obviously, I don't spend a ton of time on the beach because I turn lobster red almost immediately. But I tend to have a lot of people thinking I'm a lot younger than I am simply because I haven't spent as much time in the sun. So they're always shocked when I tell them I'm almost 50. So
You're
I'll
doing
take
great.
it.
You're doing great.
I may walk around with white legs, but I'll
Well,
take the fact they think I'm younger than
well,
I
we'll see
am.
how after about 6 or 7 years of ophthalmopreneur conferences and see how you
When the wrinkles and everything start to really pop out.
Well, it's been great. Thanks for the time. Can't wait to get this pod out. I'm sure I'll see you probably in Copenhagen or one of these other conferences, and we'll talk some more. But some great pearls. I've got a whole page of notes that I'm going to go over. So this is great. Great for our viewers. Thanks again for coming on.
Thanks so much for having me.